So let's say that you think you might have trigger points in your gluteus minimus, and those trigger points, they can be causing pain in your butt, they can cause pain shooting down your leg, they can also cause pain right on the outside of your knee. It could literally just be like right here, okay? So it could be in any of those places, all right? So it won't hurt to try this, all right? So let's just see if that helps your pain. So what you can do is you can use a soft ball. You can get it from OPTP. I recommend the Maxi ball. It's a little bit bigger and it's really good for the hip. So what you want to do is you want to find a wall, okay? Don't do it against a door like I'm about to do. Use a wall, all right? So what we're going to do is we're going to locate gluteus minimus, okay? It's like there's a gluteus medius and there's a gluteus minimus. The minimus is underneath, so I sometimes stumble on it. Okay, so it's going to be, you find your top of your iliac crest, you're going to go just below that, okay? And it's going to be just a little bit deeper, a little bit further back. So if I find the top of my iliac crest and my hands are forward like this, and then I just let my fingers come down, then about my fourth finger right here is going to drop right into the spot where I want to be, okay? I'm going to take my ball, which I know it's blue, so it doesn't show up very good, so I'm just going to pull this up. Okay, so I'm going to take my ball, I'm going to put it there, I'm going to go up against the wall, okay? And then what I'm going to do, remember this is a wall, not a door, don't do it on the door, okay? What I'm going to do is I'm just going to glide along here, and I'm going to juice up that tissue, loosen it up, okay? So just moving it around. If I find a sore spot, what I want to do is I want to just move back and forth, up and down, right in that spot. If you feel any pain shooting down your leg when you do this, that's a good sign. It means that you're actually getting to that trigger point. So then what we want to do is just lean into it and breathe. And you're going to stay there for several breaths. And if you feel pain shooting down your leg as you're doing this, and it could even shoot down to the outside of your foot, that means you're actually right on a trigger point and you're releasing it right now. So it's a good thing. Okay, so you just lean into it and breathe. Let it do its thing, and you stay there until the pain goes away. You can even do a little like this to shear. Move your leg in and out to shear like that. What that does is it tacks the tissue down and moves it against the pressure of the ball, and it helps the trigger point to release. Now it's starting to go away. That pain is going away. So it stays about that long, okay? Then you're going to take it off. That's a simple way to release a trigger point. Now there's other options that you could try. If you happen to have one of these cool things, you can use this. You can get in there and work on that area. The thing that's not as good about one of these is it's not as pinpointed. So for trigger points, not as good. Better for just fluffing up the tissue, and then get in using a soft ball like this. Okay, if you don't have a ball, you can always use your fingers. So to use your fingers, what you can do is lay on your side and put your head on a roller or a pillow, okay? So you don't mess up your neck trying to help out your leg. And then get your fingers right in that same spot, okay? And have your knees stacked like this, and then you're gonna just do some stuff like this, up and down, side to side, some circles, okay? And then if you find a sore spot, dig in there, put some pressure, and then move your leg like this, up and down. Bring it in front, like that. So you've got that sustained pressure, really push hard, okay? Do it several times, and then just push hard and hold, and take several breaths. Okay, you wanna have your leg like this. That's gonna help it to release, okay? Another great option for releasing trigger points is to use the PureWave. This is my favorite at-home vibrating tool. In the clinic, we have some more powerful tools. I actually like this tool even better than any of the other popular tools that are out there, like the Theragun. This one is a lot more versatile. There's a lot more that you can do with it. And we have a whole library of how-to stuff on how to release pain and stiffness using this tool. So if you're interested in that, you can check out some of it on YouTube. And then we also have a members only area that can give you some more information. So I'll just show you for trigger points, what you can do with this is you're gonna turn it on and wait for it to beep twice. Okay, and then you're gonna turn it all the way up. And you want to be laying down. Okay, and you're gonna just apply it right to that trigger point area and let it do its thing. So you put it right on the trigger point, so you'll identify the trigger point by being an area where it's really, really painful when you push on it, where it causes pain to shoot down, okay? More painful than other areas on that side hip area. Okay, so you leave it on there for 30 seconds to a minute at full blast. Okay, and full blast on this tool, on that end that I'm showing, is 10,000 RPMs, which is the best for releasing a trigger point. And that's why this tool is especially special, because Theragun doesn't have that, and I'm not aware of any other tool that's on the market for under $200 that has this capability. So it's a really nice capability with this tool. Now, if you try all those things and your trigger point doesn't go away, then it could be that it's something else. It could also be that maybe it goes away for a while and keeps coming back. Well, if that's the case, it might be that you actually need some proper strengthening to keep that trigger point to keep coming back. So you can reach out to us and ask for a free doctor consultation, and we can help you to navigate what the case is for you. You can also attend one of our group exercise classes, and you could be taught by a physical therapist how to do exercises properly to stabilize your hips and your back, your knees and your shoulders and your neck, and you'll get coaching in the moment on how to do it right. So those are some options for you if you find that you try some of these things. You go to Dr. YouTube and Dr. Google, and we're here because we know you're here. We want to try to help you. But if you try this stuff and it's not helping, then maybe you need to look a little deeper. There could be a root cause that needs to be addressed, and we can help you with that. So reach out if you're having trouble.